Hi, I'm Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, JP Nagar, Bangalore. Ovarian cysts. Ovarian cysts are sacs of fluid that can form inside the ovary or on the surface of the ovary. And these could be either normal functional cysts that form as a part of ovulation, or they could be growths inside the ovaries. Whenever it is a functional cyst, soon after ovulation, if at all, the follicle does not rupture fully and the egg doesn't come out of the follicle, there could be collection of the follicular fluid inside, and this can swell up and become a follicular cyst. Sometimes there can be ovulation, the egg could get released, but still the corpus luteum, the structure that remains behind post-ovulation, can again get filled up with fluid or a little blood in it and form something called as a corpus luteal cyst or a hemorrhagic corpus luteal cyst when it has a little blood inside it. Most of the times, the functional cysts don't cause any symptoms. They could be just a mild pain or a dull aching pain, especially on one side of the body, especially in the lower abdomen, and sometimes it goes unnoticed and it can just go off all by itself within a span of 30 or 60 days. That's why when a scan is done during periods, if at all a cyst like this is seen, then we call it as a functional cyst or hemorrhagic cyst or a corpus luteal cyst, and we just ask the lady to be a little cautious with respect to her physical activity, because sometimes if this is too huge, especially more than 3 centimeters, rigorous physical activity, running, jumping, skipping can sometimes result in a twist of the ovary because it gets heavier and the ligament or the stalk that holds the ovary can get twisted and result in a condition called as ovarian torsion, which can sometimes be dangerous. And that is the reason why we ask women to restrict physical activity whenever there is a functional or a corpus luteal hemorrhagic cyst that is huge and found in the early part of the cycle. Most of the times it doesn't need any treatment, as I already told, but sometimes when it is huge, a course of contraceptive pills can help in resolving this cyst. The reason why we're scared of torsion is that a laparoscopic surgery might have to be done to untwist this torsion, and therefore it's important to be careful whenever there is a huge ovarian cyst. Sometimes these cysts could not be a simple hemorrhagic cyst as described earlier. It could be a cyst which grows as a result of some hormonal changes. The most prominent ones are cystadenomas, which develop on the surface of the ovary and are nothing but sacs filled with clear fluid. But sometimes there could be a solid cyst inside the ovary, which can have structures like the hair, the muscle, or the tooth, and they are called as dermoid cysts. Most of these cysts, when they grow too big in size, they have to be removed laparoscopically, and it's not a real major life-threatening situation if such a cyst is there in somebody's ovary, as it can be removed by an experienced laparoscopic surgeon in the safest possible way. However, some women develop menstrual aches, pain during intercourse, and it can also cause low backache every time they get their periods because of complex cysts in their ovaries, which are called as endometriotic cysts. These endometriotic cysts usually are comprised of menstrual blood. The normal menstrual flow is supposed to be outside, but sometimes there is a retrograde flow of blood from the uterus to the ovaries, and the ovaries get filled up with this menstrual blood, and that results in the formation of these blood-filled cysts, which we term as endometriotic cyst. Endometriotic cysts make pregnancy difficult as the ovulation, the quality of the oocytes, and sometimes there is a phase of inflammation in the pelvis that reduces the chance for implantation of the embryo inside the uterus. And therefore, whenever there are endometriotic cysts, we usually ask these women to be quite careful and plan for pregnancy as early as possible, as pregnancy is the only way how endometriosis can be solved naturally. However, cysts can be varying in their nature, the size, and the location. It's always advisable to seek the help of a gynecologist or a fertility specialist whenever there is a cyst, and not to ignore the presence of these cysts.